Oh, no, you guys. We just recorded 25 minutes of this episode without recording. Okay.
Oh my God.
That's why you check.
Holy ass.
What?
Secondly, is the delay still there? If I say 1, can you say 2 right after me? 1.
Just kidding, yeah.
You asshole.
I'm Alicia.
And I'm Liam. We both have OCD. And instead of spiraling alone, we decided to turn our symptoms into a podcast. You're welcome.
Here, we overshare real stories, laugh through the anxiety, and talk to actual experts who can explain why your brain keeps asking, what if I accidentally marry my cousin?
Whether your thing is hand washing, mental rituals, or just silently panicking during normal conversations, congrats. You have found your people.
This is a safe place, unless you're an intrusive thought, in which case, get in line, buddy. We're booked.
So grab a weighted blanket, cancel your plans for the 5th time, and let's dive in. This is the OCD Confessional.
And yes, we did check this recording 4 times before uploading it. Okay, welcome back to the OCD Confessional. Today's episode is really special because we're pulling back the curtain on what OCD looks like, not just for the person living with it, but also for their partner. I get to sit in the interviewer chair today and talk with Liam and his beautiful wife, Dr. Lia Martin, who's not only been right by his side through his journey with OCD, but is also a clinical psychologist. We'll talk about what it's like for her to support Liam at home, how they navigate OCD as a couple, and what insights she's gained both personally and professionally. This is one of those conversations that shows OCD isn't something we go through alone. It touches the people we love too. So let's jump in. Here's Lia and Liam. So I'm excited for this conversation because a lot of people will hear about what someone with OCD goes through, but we don't often hear a lot about what it's like living with somebody who has OCD. So I'm just going to dive right in. Lia, welcome. When did you notice something might be going on with Liam?
The first thing I noticed was like a personality shift in Liam. I didn't notice like the OCD symptoms per se. And also, can we just say like, I'm a clinical psychologist. I probably should have. So I don't know how good I am at my job.
Yeah, you really fail.
Really makes me question myself here. But no, the first thing I noticed is Liam is typically a very patient person. Like I'm the snappy parent. I'm the one who has like a short fuse with the kids. I'm always yelling. I'm the yelly parent. And Liam is the one with like the infinite patience with me and with the kids. And the first thing I noticed is that he seemed like really irritable and he would snap at me about things that normally didn't bother him at all. And to the point where I was like, where is my husband? Like, who is this person? I didn't really recognize him. He had such a short fuse. And that was sort of the first sign I had that something was wrong. I didn't really know it was OCD yet, but I knew something wasn't right.
It's funny because in those moments when I would lose my patience, before I recognized that something was going on with me, I sort of just thought, honestly, it's her fault. Like the reason I'm snapping a lot and being a dick is because she's annoying me or pissing me off in some way.
Yeah.
And
That's fair.
I think at some point we had an argument in the kitchen about, I don't even remember what it was. And I snapped. And then she said, I think we might need couples therapy. And that really hurt actually, because I so value my role as a husband and a dad. The thought to me of like, I have failed to the point where we might need to go have therapy, which again, that is a whole thing with the stigma of therapy itself. But to me, that was a real wound. Like, oh shit, she thinks that we're bad enough off that we need therapy. Like, and that made me do a little bit of thought.
So relate. Yes. Okay. Sorry. Go ahead.
No, that made me do a little bit of reflection of like, so what is there a pattern that is happening here that I am contributing to? Through that reflection, I started to understand, yes, there are some patterns going on here that have emerged. Stuff that had happened earlier in my life that I had managed to get through was kind of rearing its head again and showing up in our relationship.
Maybe when Lia recommended talk therapy, it was like, oh my gosh, this is real. I'm now making this real. And that's so scary because you're like, am I creating an environment with my story? And then I think it all starts to become so like messy almost, because now you're trying to identify what is made up in your head and what is actually really wrong with the marriage.
Self-fulfilling prophecy. It's like a Greek tragedy. No, that's the really tough thing about OCD is that it makes it very hard to distinguish reality from your fear. And you grow to not trust your thoughts and not trust your instincts anymore because your instincts are so fucked up. And I think the trip to Turks and Caicos would be a great example of that. You want to tell everyone about our famous plane ride to Turks and Caicos?
I always bring a sweatshirt on the plane, and Liam is a generally like warm person, so he did not. And when we got on the plane, it was really warm actually to begin with, and so I didn't need the sweatshirt. And he asked, "Could he borrow it?" And I said, "Sure, but when we start to fly, like it's gonna get cold, and I'm gonna want it back. And you should probably ask for a blanket now because I'm gonna want that sweatshirt back." And then they pressurized the plane, which is like, I don't know, it just puts Liam to sleep like immediately. Like he was out. And so 20 minutes into the flight, of course, as I predicted, it got cold, and I'm like, a sweatshirt. And I would really like my sweatshirt back. So I'm like, Liam, Liam, can I get that sweatshirt? I woke him up to get the sweatshirt, and his level of rage, like it wasn't a nice thing to do. And I had other options. Like I could have asked for a blanket. I had other ways to solve it. So it wasn't the most sensitive moment, but his level of anger at me was so disproportionate to the offense, I felt like. And how long he held on to his anger about it. Like through the flight, when we landed, he's like telling our friends about it. Like, can you believe this horrible thing that she did to me? And I'm like, my friend Danielle's like, I would have done the same thing. Sweatshirt.
And he hasn't slept in a decade, so he really needed that.
That's true.
Oh. So I was like, what is up with you, dude? Like, why are you so grumpy?
Yeah.
Why are you so mad?
And what she didn't know was the background to why that upset me so much. So for that period of time, my OCD and my obsessions had centered on this fear that she was going to leave me and that I wasn't good enough and that she was going to be unfaithful. And so in that moment on the plane, I've got this sweatshirt on. For her to wake me up out of my sleep and take the sweatshirt back from me felt like a much bigger offense than it would have been had this not been my fear, is that she doesn't care enough about me. I wouldn't have taken the sweatshirt from her. That should be reciprocal. And it all played into this fear I already had that she wasn't really that in love with me anymore.
Right. And it completely catches her off guard because she's not in your head. She doesn't know the story that you've been creating for the last however many days or months or weeks.
And it was so confusing to me because I had actually thought our marriage was leading up to this. Like, I felt like we were in a really good place, actually. So it was, it was really confusing to me.
Looking back.
When you have OCD, you become a detective and you're out looking for clues that build the story that you're creating in your mind, right? You're looking for evidence. And then the central suspect in your story doesn't even know that they're a suspect. Like she had no idea that I was living with this fear that she was going to leave me. And there was no evidence of that, despite how hard I looked for it. But when I did find a little piece, like the sweatshirt, I made that, DNA level evidence.
Yeah.
And then it was like, oh, yep, I was confirmation bias. This is exactly what I feared. She doesn't love me as much as I love her and blah, 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 blah.
We know they love us. We know we're in this. We know, like our family is solid. And we are just so good at creating these elaborate, unnecessary stories that are painful. They're painful. Had you told her along the way of these intrusive thoughts, like, I fear you're going to leave me? Were you vocal about that at all? I think you're,
Nope.
and
No. The first time it came up was on the flight home, actually, right?
Oh.
So
Yeah, that trip to Turks and Caicos was kind of a turning point for me in that I started to recognize things were bad enough that I was gonna have to tell someone, and it seemed like my wife would be a good place to start. Um, so on the flight home, she was watching Dirty Dancing, one of her all-time favorites, and I was like, "I know I don't wanna interrupt her watching this, but I'm just in a state, and we finally have a couple of hours during this flight." You don't typically get that as parents to
Yeah.
talk about this. And so I did. I was in tears and I told her that I had really, really been struggling. And I didn't have the word for it. I didn't know it was OCD. She hadn't identified yet that that was what it was for me. So I conveyed finally that I had this fear and that it was weighing on me a lot.
But that wasn't a light bulb moment for you, Leah. Like, what was the final moment where you're like, I think you have OCD?
We were on a trip, another trip. I don't know what the trips bring out for us. It's supposed to be relaxing.
Traveling when you have OCD can be very hard.
Yeah, it's probably the stress of being out of your environment and your routine just kind of like,
Yeah.
exacerbates everything. So we were on a family trip to New Hampshire, Vermont, or something like that. And while we were on that trip, one of my girlfriends texted me and said, like, hey, I'm going to do a bachelorette party. She was about to get married. And she gave me the date, and it was like a murder mystery kind of fun, sort of like innocent bachelorette party. And I went to Liam and I said, like, hey, does this weekend work for me to go to Sarah's bachelorette? And he was like, why do you have to go to that? Like, I don't really want you going to that. And this was
Again,
sort
out
of
of
the last.
character for Liam, probably.
Very out of character. He's like a super respectful, loving, supportive partner, and he's never cared. Like, I went to New Orleans on my own bachelorette party. It was wild. He did not care. Like, but I had gone on a work conference. He was kind of angry about me about that, and it definitely didn't seem to be about like taking care of the kids and being left with like homeless. It felt like there was something else, and so that was like the first moment where you disclosed to me sort of really, I think the fears about me leaving.
I saw how frustrated she was. I finally had one of those, thankfully, I had one of those moments where you can go, oh, I'm being crazy, which are not always available to you when you have OCD, but thankfully I did.
Yeah.
And I had her come into the bedroom at this house where we were, and kids had gone to bed. And I said, let's really talk this through. And I revealed that that was my current obsession and made a deal with myself that however much pain it caused me, I needed to let her do her thing.
I got to a place with that whole trust thing in the very beginning where I was so exhausted with the thought of it happening that I basically was like, I have to let go of the control and the thought because it was so painful to think that you almost are like, well, if he goes and does it, then that will release that thought. At least that will release the thought of it.
Mhm.
Does that make sense?
You want to have an answer and not have to live with uncertainty and
That's it.
fear.
Like if he does it, then okay, then I move on from that because the torture of thinking it was going to happen every single time was too much. So now I'm just in a place where if he goes on a work trip, it's like, great. I can't go there mentally. I just can't. It's too torturous. It's too painful. So, which is good. And, lets that control go. And that's part of it is like talking yourself through that and allowing yourself to let go of the control. And I think we control the things we care most about. Now that you know that he lives with OCD, how do you navigate that line between being Liam's wife and having all that professional knowledge at the same time?
You can't ever stop having the knowledge that you have. I was talking to Liam about this last night. I was like, it'd be like if you were a medical doctor and you saw your kid having symptoms of the flu. You're not going to be like, oh, well, I can't be a doctor to you. Like, I'm just going to take you to urgent care and let them fully figure it out. Like, you're still going to use the knowledge to be like, hey, I think something is going on, right? So, in trying to figure out what was going on with him, I think actually was really helpful. 'Cause one thing that happened for Liam is he went and he got help. He went into therapy. He started going on meds, but he really thought he was going for help with depression and anxiety. Like he knew anxiety was part of the equation and that he was having anxious thoughts. But I think he thought it was like garden variety anxiety, like a good old like generalized anxiety disorder. And after a while, the treatments really weren't working. He had tried a few different medications, and he was still really suffering quite a bit. So one night we were just laying in bed, and I was like, I did the thing that you're really not supposed to do, and I like therapized him a little bit. And I was like, so like, could you just help me be in your mind? Like, what are you thinking? Like, what happens for you? And he starts describing these really intrusive, highly distressing thoughts. The intrusiveness was really what like keyed me in. And I was like, boy, you are describing, I don't think this is just anxiety. What you're describing sounds like OCD. Like maybe ask your doctor, does this sound like OCD? And that's sort of how we got into it. So I think without that sort of little level of insight, if I just sort of ignored all that, it would have taken longer for us to get to the answer. I also don't reassure him through text messages and stuff because I know that that's just reinforcing the OCD and the obsessive thoughts. Like, right, I'm sort of trying to be part of the
Exposure.
yeah.
If you're new at realizing that you have OCD, if you're like me and trying to understand what all this means, can you give the listeners a little bit of an example of reinforcing a compulsion looks like or sounds like?
So the obsession, right, is like a really intense, intrusive fear. It gives you so much distress that you can't just sit with it, right? You have to neutralize it in some way. So you say something, you do something to make it go away. So when you text someone to say like, did you get there okay? And you immediately hear back, yeah, I'm okay. That for that moment diffuses your anxiety, right? Like you're like, okay, they're all right, right? You can't. And so then it reinforces this idea like that something could have happened and I have to know that they're okay. I can't just sit with the lack of knowing. You can't just sit with that. We all feel that. I mean, I put my kids on the bus. I hope that they're safe while they're at school, but I don't have intrusive ruminative thoughts about it all day long, right? And so it's the behavior, that temporary relief that you get from checking in. It works for a few minutes. And then all of a sudden that intrusive thought, well, now what if something else happened to him, right? So in that way, it never allows you to learn how to sit with your own anxiety around
So
the
our advice to friends moving forward would be to ignore my text message and have me just
Yeah,
sit in my house.
absolutely.
For how long?
No.
My husband's laying on the side of the freeway. That seems okay.
So, you go for the low-hanging fruit first, like the stuff that's easier to tolerate. So if that's like the one that's hardest for you to tolerate, like don't go at that one first. But if it's an easier one to sit with, then maybe that's where you start.
You should also probably have Spence just sleep with someone else. Right?
I mean, kind of, right? You're like, get this out of the way. Move on to the next one. No.
And then it's literally exposure of him to someone else.
Oh my gosh. That's funny. I can't go there. I have learned that the more I vocalize it, hey babe, I'm in a funk. And my way of expressing it to him is I feel stuck. I feel very stuck right now. And he'll go, okay, how can I support you? And I'm like, I think you need to either clean the house with me or no. I mean, all jokes aside, we have these moments of like, here's where I am. He'll ask, how can he support me? And I either have an answer or I don't. And I just need him to be aware of where I'm at. We don't have the answers. I know that I'm really struggling today. Some days I don't leave the house. I'll just, I kind of just like clean and look for things to be tidy. And he knows that and he'll respect that. And he'll say, hey, like, I don't have a busy schedule today. I can do the things that need to be done with the boys and I can take them, places. Why don't you do what makes you feel good? And I think that is so important. But also, he's kind of lost in how he can help in those moments too. It's all new for him as well, and we've been going at this and kind of chasing our tail and wondering what works and what brings the peace to the house. And that's what we're all hoping for is moments of happy Liam and happy Alicia. And that is when our spouses are their happiest as well, is when they can see that we are enjoying the life. And so I guess that brings me back to, how do you guys navigate that in the house with the kids? And what do you do, Liam, when you know you're spiraling, and how do you support that, Leah?
So one thing I'll say about Liam is he's really good at masking. Like he does he has a lot of obsessive compulsive behaviors that I never noticed. Like he is a tapper. He does some things with,
That's a compulsion?
keeping lights and stuff.
Alicia's been tapping this whole time.
And I never noticed them. As we got into the discussion of OCD, really a lot of his obsessive compulsive stuff that he initially described was very mental, like very rituals, things he'd do and say in his head. But as we got down into it, like there's a lot of behavioral compulsions too, and he was very good at hiding them. And even his mom, like he just had a conversation with her. She's like, "Oh, OCD," like people.
Right.
He's very good at hiding it. I think there's a certain level of shame for people. Sometimes I don't know. I don't want to speak for you, but and so you get good at hiding it. So I don't necessarily see his OCD flaring up. So I do have to rely on him to communicate and let me know. Really, his great tell is his irritability, because like I said, he's not an irritable person. So the second I notice that he's a little short with me, a little short with the kids, that's like his tell that like he's having a hard day, and we check in with each other. But I also rely on you to communicate a lot with me about what's going on for you and what you need.
All I heard there was that I'm really good at OCD.
Positive. We'll
Like,
take it.
did you hear how good I am at masking? She said, like,
We all
he's
are.
really good. Yeah,
Yeah,
thanks,
very good
everyone.
at
Kind of a big deal.
You mentioned the shame thing, and not speaking for us. I'll speak for myself when it comes to that. There is an immense amount of shame. And I have thought it's because of the trauma and stuff I came from. And I've always walked around thinking that it was like written on my forehead, and I was exposed to it, and everyone was like, "Oh, that girl grew up in a house with a blah 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 blah." But the more I'm learning, it's the shame on the storytelling and the intrusive thoughts that I've been having and I have dealt with. So yes, there is
so much shame. And I think that you won't find many people with OCD who don't carry that shame.
right.
Partly because of the stigma around it. I think for a long time, people who have some of these compulsions were mocked, and there hasn't been a very good understanding of what OCD is. You have the Kardashians talking about they're so OCD because they like to have things, arranged in a certain way or neat or something. And so there's this big misconception about what it is. Yes, I definitely carried a lot of shame, which is why I masked, and I didn't want her to know anything about it. But I think what was so valuable about that conversation we had at first, where I finally opened up, was that it allowed me to see that it wasn't going to scare her away.
Yeah.
When I first told her, she said, "Well, why haven't you told me up to this point?" And I said, "Well, I was worried that I would appear weak." And she said, "The strongest thing a person can do is to ask for help." And
You could say that.
that was profound to me in the moment. And seeing that it didn't scare her away, and my greatest fears of looking, weak
Yeah.
were not realized, allowed me to continue to do that. And so you ask what it looks like now. I'm very open about it with her, where if it's a bad day, I don't always tell her if it's a bad day, but if
Yeah.
she's got something
She's
going
having
on
a
in her
good
life,
day.
right?
True.
I'm trying to not overdo it, and not put her in a position where she's constantly having to cater to me and to my feelings and
Right.
all that. But if it's a particularly bad day, I just say straight up, I'm having a bad day, and I'll do it privately when the kids aren't there. And it's not even, I'm not looking for a solution. I'm not looking for her to, although I guess if you got naked in that moment, that would be helpful. But I'm not looking for that in particular. It's more just like, I just want her to know. And there's just some comfort in your partner being aware that that is your state in the moment. And she's always
Yeah.
great about it, but there's not some magic that she can put on me in that moment to make it go away. It's just my life partner, my person knows that that's my state right now, and that somehow gives me comfort.
Has your OCD changed your relationship in any unexpected ways?
I think it's strengthened our relationship. I think, like, when you take your vows and you're like 20 something years old and you're like, for better or for worse, you can't really conceptualize like what that for worse looks like. And
Yeah.
then all of a sudden you're there and you're like in the thick of it and the worst of it. And you're sort of like, yeah, this is what I meant when I said like
Yeah.
I'm there for you regardless. And one of the things we actually did around that time was a vow renewal. And it felt really important to, at the time, it was probably reinforcing his OCD, but I didn't realize that. I was like, I'm just going to reassure him I'm not going anywhere. But
It's
for
very
me, it
validating.
was my way of trying to show him, like, I'm here. Like, I'm
Yeah.
here regardless of what this is and what you're going through. Um, and I think it helped us be better communicators for sure and be more vulnerable with each other. So I think like, it was a real test when things were tough, and we were fighting and I said like we need couples therapy. That was like a tough moment for us.
Yeah.
And I think we came out much stronger for it.
Yeah. No, I mean, we are getting a divorce. It has definitely made us strong. I think your relationship can only go as deep as you are willing to let your partner in.
Yeah.
And especially for men, we really struggle with vulnerability and letting our partner see all of us. And we were 12, 13 years into our relationship before I actually did that with her. And I think it gave her a much more complete view of who I am and allowed me to see a more complete view of who she is as someone that's willing to accept that and love me despite the issues that I had never revealed to her until then. And in a strange way, I feel like my OCD made me a better partner for a time. Where when my obsession was that she was going to leave me, I became the best husband ever. I was
He's
like,
really good.
doing dishes and emptying the
Oh,
dishwasher.
that's not anymore. Oh my gosh. Can we bring it back?
You're like, you're not gonna leave this.
Because I got
This
some
next
dishes
guy
that like
is gonna
to
do
get
the
done.
dishes. I'll show you. Yeah,
I
I
was
get
just like
that.
the most generous partner ever because I was like, if I do enough things, then she won't leave me, and I am good enough, and all that.
Yeah.
So there's been some writing of the ship in that sense, but yeah, I think overall it's actually been strangely really, really good for us
We've
to.
also talked a lot about our love languages because I think, we're different in what we need and in the way we show care. And so I realize that some of the ways that I show love don't really sort of meet your emotional need. And that also leaves you feeling, it leaves space for the obsessions to creep in. And so I think
Right.
we've done a lot of talking around that as well.
Do you feel like there are triggers to your obsessions? Do you feel like you can identify what those are? I think for a long time for me, I've been on a hunt, and I've even vocalized this to Spence. I'm like, I really need to figure out what my triggers are so then I can avoid them. And that leads to avoidance, right? And that's isolation and all the things because I'm now at home going, I don't want to be triggered. I'm just gonna do and that can be a very lonely, isolating feeling, especially when I'm a very social person naturally. I love my girlfriends and I love hanging out with them, but I'm also very fearful of, will I be present? Will I show up as my happy self? Will they like the version of me that shows up? And how do I explain to them that I had a really shitty day just in my head all day? Will they accept that? So, I have spent a lot of time trying to figure out what those triggers are. And maybe that is part of the OCD is, and what keeps me in the loop, is trying to problem solve that in itself is a obsession.
And that is such an interesting aspect of OCD, is that if you identify a tool, do you start to perform it compulsively and ritually, and then you're just creating some other compulsion. That's boy, is that fucked.
Which I've lived in my whole life and have wondered why I ghost everybody and why do I just like fall off the face of the earth. And I think the ones really close to me are able to check in and be like, thinking of you, I love you, and I'm here for you. And I'm like, oh, on one hand, I'm like, why are they saying that? Do they know? Why am I like, is it okay, I'm good. Yeah, I'm here, just busy. Or do they know that I'm just like ruminating thoughts and in my house? Like it's like and then I start to think all the things of what people are thinking about me and how they perceive me and shit, you know?
Fuck.
I mean, that's the thing about obsessions is that they're irrational, right? Like the things that trigger them are going to be sometimes unpredictable. I mean, you
Are
have
they
your
though?
predictable things, like you have increased stress, lack of sleep, like, actual, things to worry about. Those are all going to spike your obsessions, but by nature, they're so irrational, right? Like they are rooted in things that maybe everybody fears, right? Contamination fears of getting sick, fears of something horrible happened to people we love, but they become big and distorted, and then they become irrational and they become intrusive, right? They just flare up with no real rhyme or reason. That's by definition, an obsession is an intrusive thought. It comes in when you're just trying to live your life and it shouts at you over and over like, hey, I'm here. You should be worrying about this thing. Worry about me, worry about me, worry about me. And there is no rhyme or reason. Like if there was logic to it, it would be a lot easier to deal with. You just be like,
My
you're being
goodness.
illogical.
Thank you
Yeah.
for that. This is spot on, Leah. And oftentimes I'll share the thoughts with Spence and he'll just giggle. And I'm like, why are you laughing? It's not funny. And he'll be like, honey, come on. And I'm like,
Yeah,
no,
to the
this is
outside
very
person, you're like,
serious.
well, that's sort of rational.
Right. And I'll look at him and then I'll almost get mad at him for laughing at what feels like a very real serious conversation that we need to have right now. And he's like, yeah, I love you so much. I gotta go. I'm like, okay, fine. I guess you're right. That was a little much.
One day you two will laugh at them here, hopefully.
Yeah.
On the show.
Yes. I want to ask Leah, what are some tools that you would recommend for somebody that has OCD, intrusive thoughts, compulsions? What is your go-to tool that you would recommend?
Therapy, obviously. Keep me employed,
Is
please. No,
there's certain I
yes.
know there's
So the
ERP, right?
ERP. So that's sort of the gold standard treatment, exposure and response therapy or response prevention therapy. It's a form of cognitive behavior therapy. And full disclosure, I am not a CBT therapist. My background is in child trauma. But that is sort of the gold standard intervention. And it's really focused on two things. I mean, the main goal is to break that reinforcement cycle of having the compulsions reduce the anxiety around the obsession for you. And so instead, you learn to sit with the anxiety that's created by the obsession. So you're going to test the logic and the rationality of the obsession. Most people with OCD know those are illogical obsessions. And then you're going to learn tools to sit with the distress and allow yourself to habituate or get used to the anxiety and notice that it's going to go away on its own eventually without needing to perform the compulsion. So that's the response prevention. You don't get to do the compulsion to get rid of the anxiety that's produced by the obsession.
What if we don't have access to talk therapy? We can't. What if the compulsions change so often and frequently and we're constantly moving on to another one? I mean, how do you navigate the exposure to so many different things? I mean, that seems like a full-time job in itself, and people have lives to live. And I feel like that sounds like a lot of work. I've done it naturally. I'm like, oh, yeah.
So the beautiful thing about ERP, it doesn't have to be specific, right? So the skills that you learn help you sit with the anxiety, which anxiety is anxiety, right? No matter what obsession triggers it, and no matter what compulsion you do to get rid of it, anxiety is anxiety. So the tools to reduce anxiety stay stable despite the obsession changing or the compulsion changing. And, there's a lot of ways that you can get talk therapy now. So even if you can't do it consistently or you can't talk to someone in person, there's telehealth, there's all kinds of platforms for doing it. So I would say like don't self-treat it because it's a really tricky, hard thing to deal with OCD, and you want to make sure you do it right, and you want to make sure you do it with the right pacing, right? You don't want to like flood the system and totally overwhelm yourself and really derail your progress by trying to do it yourself. So I would say if you can't get yourself into therapy right away, just talk to the people around you, try to help them understand what it is you're experiencing, get some support, um, try to find tools that help you sit with anxiety. A lot of things that you described, like getting good sleep, eating well, exercising is a great outlet. Meditation, mindfulness meditation, I would say, is a wonderful practice, and it's really at the heart of some cognitive behavioral interventions because you teach your mind how to focus on what you want to focus on, right? So you may have that intrusive thought, but you learn to have control over where you put your cognitive attention. You don't have to attend to that thought. And so mindfulness meditation is a really good intervention you can do without a lot of work. You can get like a self-help book on that.
And then in terms of tools, can we talk about Danny DeVito? Okay. So one of the tools I developed. Well, you gave it to me, but I developed it in my mind, practiced it. One of the tools that I practiced was when I had started talking to Lia about what was going on. I said, I have all these intrusive thoughts. They're barking at me all the time. You said, try to externalize these thoughts a bit, create a character who is barking these things at you, these
The
fears at
psycho
you.
jargon is displacement. Like take it outside of yourself. Give him a personality. Give your intrusive thoughts like a voice, a personality, so that they're no longer like in you and part of you, but they're sort of like outside of you a little bit. You can
Now
examine
you're
them a
just
little bit
arguing
better.
with Danny
Left-
DeVito.
Exactly. Exactly.
My guy that I created is Danny DeVito, a short little guy that just yells at me about that I'm a piece of shit and, my wife's going to leave me and all this stuff. And then it helps a little bit that it's Danny DeVito.
Because it's
yelling those
absurd.
things.
It's like absurd. And you're like,
Yeah.
shut up, dude.
Does Danny DeVito show up a lot for you, Liam?
He's there. He's always there. I actually should reach out to Danny DeVito and see if I could get him to say some of this shit to me and I have it as a voice recording. Wouldn't that be great?
That would be it. That would be cool, actually.
Well, you both obviously have a great sense of humor. What role does humor play in navigating OCD together?
He's actually way funnier than I am. I bring the brains, and he brings the
Brawn?
You bring no brains, Liam. Sorry.
No, but he really has an amazing sense of humor. And,
You are funny.
He's very punny.
There was a period of my life where I didn't have access to that. And it was so dark. And I think the therapist I was seeing at the time said, I can see that there's no light in you. And I couldn't laugh at the issue. So first I want to recognize that there are people listening to this who will go, I can't see a future in which I can laugh at this. But I assure you, you can get to that place. And it was kind of a matter of practice of just, I would say this thing to Lia that I was thinking might happen. And then I would sort of force myself to crack a joke about it. And that would sometimes feel a little scary that, if I'm laughing at this, is that going to make the thing happen? And the OCD and the magical thinking comes back into play. And it just took practice of being able to kind of find it funny, like that, the crazy thoughts in my head, they're so absurd. It's like absurdist humor.
I think that's part of eliminating some of the shame too and acceptance, right? And when we can accept it and say, this does not mean I'm broken, this does not change my personality, I am still a rad person with a big heart, who is an amazing father and husband, I just have these things. I have these thoughts, and that is what makes me unique and amazing. And I think giving yourself grace for it and accepting it is so huge. And I'm still in the process of that. And I think I asked Spencer, I don't know, I can ask him right now 20 times if it was okay that I speak about this on a podcast. I needed his approval. I needed to make sure that this wasn't embarrassing for him. And he has always been so supportive. And I think when people are alone and they don't have that support and they don't have a partner to laugh with, it's awful.
An isolating, it's an isolating experience. It's isolating enough even when you have a partner because they're not in your mind. They don't feel how painful it really is.
How mean we are to ourselves. That's the biggest one is like, I don't think Liam has a mean bone in his body. I know I don't. And the amount of time that we spend to just being mean to ourselves is really hard. And I think for anyone listening, if you're at home just beating yourself up, that you are so loved and there's help and there's hope and you can live a beautiful life. And I think it's really important to share that. And it's okay to share your weird shit. It is. I think, this last week I've shared, some of my closest friends had no idea that I've battled intrusive thoughts for so long. And I was sitting at a table at an event with 6 women, and I was talking about the podcast, and one of the ladies said, I know exactly what you're talking about. I have really dark thoughts that are crippling, and I didn't know why. And this is so cool that you're doing this. And yeah, I think we're going to help a lot of people, Liam. So
yeah.
Can we cut all that
That
out?
was beautiful.
Yeah. A little therapy. I should let you know that my hourly rate is $100.
Should be higher.
No, thank you for having me. It was really fun. Appreciate it.
Thanks, love.
Aw.
We can continue. Boy, she was a wet blanket, huh?
Snooze.
Should we end with a quick little confession?
One tiny little thing that I do that I've noticed is when I have a bad thought, I immediately have to think of a good thought right after to neutralize the bad thought. Do you do that?
So you basically have like the angel and the devil on each shoulder all day, just like the devil's like this. And
oh, yeah.
We hope you are enjoying the OCD Confessional. You can subscribe on all the podcast platforms. You can find us on Instagram at the OCD Confessional. Same handle for TikTok. We're all over there. Send us a DM. Tell us what you think about the show. And if there's a guest you would like to hear, if there's a question you want us to explore, we are really happy to get feedback from people who are listening.